Hi, and welcome to an episode of the Play Therapy Circle. I'm Kylie Ellison, a therapist, clinical supervisor, and play therapy trainer, and I'm so grateful you're here. This podcast is a space for thoughtful, soulful conversations about child-centered therapy, play-based work, and what it means to show up with presence and compassion, both for our clients and for ourselves. Whether you're a seasoned play therapist, a student just starting out, or someone deeply passionate about working with children, you belong here. Hello everyone. Welcome to the Play Therapy Circle podcast video edition. This is so cool. Welcome to our new studio, which we have literally created last night because you know what I'm like, that I'm not good with being organized. This is so different because usually I don't have anyone to look at because I don't have a video. So I hope you guys enjoy this new format. We are pivoting to having the podcast both in audio on Spotify, Apple Podcasts, and where you get your good podcasts, and also on YouTube. So you'll be able to access this video on YouTube as well. So I have so many disclaimers to give here, I guess, with what we've got set up here. So this is my space at home, you guys. So I am definitely feeling a little bit more kind of chill, that I can have this beautiful little lounge that I've got, which of course is pink. So for those of you listening on Spotify and Apple Podcasts, you can't see this right now, but hopefully you'll get a chance to see our video on YouTube soon. So you know what I'm talking about. And we will pop up a picture on our Instagram as well, so that you can see it in all its glory. But I think it's coming together. I do need to put some sort of sheer curtain to just kind of soften it a little bit. But I have a beautiful picture behind me here, completed. It is obviously available through Kmart for those of you in Australia, but has been done by a beautiful Indigenous woman who has created this picture that I just love because it's all about pink, and I love pink. And so for those of you watching on YouTube, you can see I've got my pink minky blanket. I freaking love those blankets. If anyone in the US knows what I'm talking about, I'm kind of obsessed with Secret Lives of Mormon Wives. This is just like a little bit of a deep dive into my life right now. And so I have like 4 minky blankets because they're amazing. They're weighted blankets. I highly recommend. So lots of pink in this space, which I love, but really nice that I'm no longer recording, you know, on my couch, you know, in spaces where it just didn't feel as connected and grounded. And I think that in doing this, I just love the fact that we are connecting in this way where I can actually see everyone. Well, I can't see everyone, but I'm doing a recording right now because I know that we are connecting with more and more people as we go through each episode, which is just amazing. And I love that so much. So this is fantastic. I'm so excited. This will continue to evolve, as does everything in life. So I know that we will keep adding to this space as we continue with our episodes, but would love your feedback if you like our setup here. I think it's really cool. Normally, also too, I need to give a caveat that I would normally have my microphone on a stand. This is the very first time I'm holding it. So if you can hear different sound levels, it's because I am learning how to do this. I have no idea what I'm doing. No, I do. It will be great. So I wanted to say hi to everyone listening. I hope that you have had a great week. It is moving towards the back end of October 2025, you guys. I have absolutely no idea where the year has gone, and I know I do this check-in with you guys at the start of every episode. So how are you doing, first and foremost? How are you doing? Are you doing well, or are you having a week? And either answer is fine, and everything in between is fine as well. I think that we are certainly seeing, through our practice, lots of progression, I guess, in complexity of cases that we're working with. So I just want to acknowledge for all of you in the play therapy trenches, I see you. I absolutely see you. It's not easy, but we are doing incredible work. And like I always say, it's the blessing and the curse of the work that we do. We have this incredible blessing of being able to work with kids in this way and to be able to hear their stories and help them heal. But it is also a great responsibility as well. And so it has its positives and challenges, as anything in life does. So I just want to send any love to anyone who's having a tough week this week. There is definitely people in my community who are not having a good time right now. So I just want to send all my love to all of you. I don't know if you guys follow Instagram, and again, if you're listening on Spotify, you will not be able to see this, or Apple Podcasts, but if you follow us on Instagram, I posted a story a couple of days ago. I bought a Grinch. Well, I'm using it for my iced coffee, but a Grinch drink bottle from Target here in Australia. I just showed it to the camera. You have to get it. If you love Christmas like I do, and brace yourselves, guys, for the Christmas spam in the next couple of months with our episodes, because I'm obsessed. So I think it just brings so much joy. So I think we all need that at this time of the year. So if this resonates with you, this is your reminder to go and buy a Christmas tumbler. Okay, I want to dive into the topic for today. I know that we have a lot to cover, and I want to do justice to it, because I think there is so much and so many elements of this particular topic that's important for us to work through. So what I would like to do is structure today's podcast by talking about how to conduct initial parent consultations. I want to talk about how to do then those follow-up parent consultations, and I do want to cover off on a couple of different topics that are important for us to consider in this space, of the challenges we face in giving feedback to parents, some of those common pitfalls that we all fall into, either as a beginning play therapist or sometimes as a seasoned one, and also those ethical considerations. So there is a lot to cover. So I encourage you guys to grab a tea, a coffee, settle in, because we've got so much to cover. Okay, so what I want to start off by saying that I think is really important is that we know from the meta-analyses of child-centered play therapy in the research literature available currently, that caregiver involvement is one of those key components for us to be able to have effective and successful outcomes in therapy. That is, standard here. We all accept that that's part of the research. So I know for many beginning play therapists, they can feel a lot of pressure in feeling like you need to get this right, I guess. And especially in the beginning, I always say that having experiences of working on the ground, doing play therapy, doing those parent consultations only builds your skill set and your knowledge and your experience. And it is through that experience that we gain that confidence. So I want to send that special message to anyone who is just diving into their play therapy career. Be super kind to yourselves, because it's important that you don't put that much pressure on yourselves, because that will often kind of permeate into your work if you're feeling that anxiety. So see it as an opportunity every time you do an initial consultation, as an opportunity to build your knowledge and skills, as opposed to feeling like it's intimidating, overwhelming, and not knowing where to start. So I definitely want to cover off how to do an initial and ongoing parent consultations, and I need to declare from the outset, this is something I use. Certainly there would be others in our community who use variations of that, and we are all welcome in the circle. So I think we all help to build that knowledge and skill set of our profession. So this is just one viewpoint, and I'm sure there are many others out there as well. So I had to give that big caveat at the start, just so I am outlining, I guess, what I'm going to do. So with building those relationships, we've talked earlier episodes about the importance of that therapist-parent relationship. It is critical for that success, but I also want to make sure that I emphasize here that it is a gradual process, just like we see in the playroom. So it's not going to be something that in that initial consultation, you're going to immediately, connect with a parent and it's going to be highly successful. Sometimes those ruptures and repairs, like we know in the attunement cycle of the kids that we work with in their formative years, that happens with our parents as well. There are times where there is challenges, where there is difficult conversations. And so I'm always emphasizing when I'm talking about this topic that I think it's really important that we take it gradually, but we are very conscious of investing in that relationship ongoing, because it is important for us to work holistically, systemically, but also recognizing we will have greater success if we have caregiver buy-in. So really focusing on that relationship, guys, I can't emphasize that enough. And so how do I do that when I start an initial consultation? So you might be a new play therapist thinking, I feel so overwhelmed by all of this, I'm not sure where to start or how to do it. So I think, as we say in the playroom with children, in that first play therapy session, we say that we meet the child, that the play therapy session begins when we meet them in the waiting room. It is exactly the same with parents and caregivers. So when we are connecting with them in the waiting room, it's our beginning opportunity to, I guess, make a good impression. I don't necessarily see it anymore as that, I guess, but it's more around wanting to provide an inviting and comfortable and welcoming space. So being really mindful of your waiting room and what that looks like. We have lots of color, I'm sure you can imagine, in our waiting room area. We've got beautiful purple walls and beautiful art and things around the room so that it feels welcoming. We've got couches, things like that. I think everyone's got great ideas, certainly in our circle of what their waiting rooms look like, but being really mindful of that first step of them literally opening the door and coming into your waiting room area. Then it's about welcoming them in to the space, so bringing them into your consultation room. And I always think, and I don't like to put my pressure on myself by saying this, and so I want to also say this to you guys too, so that you also don't feel the pressure. But I do think that first 5 minutes is kind of crucial. And we know from the research it is too. So if, you have a new client and a new parent, they're really going to spend kind of that first 5 minutes sort of deciding, are you somebody that I feel like I connect with or trust? So what do I do to tackle that? Very simply, I stay true to my tenets of CCPT. I am congruent, empathetic, and authentic, and I like to help them to feel comfortable. So I will say to them, did you have any trouble finding us today? It seems like a really, I guess, kind of innocuous or kind of casual question, but really it's kind of breaking the ice. And it is, like we say in the playroom, in that exploratory stage, kids will often gravitate to the things that they know how to do to help them to build and feel that sense of safety and predictability in the room, right? So we do the same with parents. So we'll say to them, yeah, had you having any trouble finding a place? The car park is a nightmare, right? Like sometimes it's really hard to find car park. Like I'm just really kind of casually breaking the ice, helping them to help co-regulate, because they will be anxious as well. It is a big deal for a parent to come to a therapist and say, I'm having trouble with my child and I don't know what to do, and actually I'm in crisis. Like that is so incredibly vulnerable. And so I want to acknowledge that that is a huge step for them literally to come to the office, like we do with children. Like this is, I guess, I hope this is making sense in terms of how I connect my work and how CCPT lives in every part of my practice, right? And so I'm always saying that I work with children of all ages, and I genuinely mean that. I think that if we come from that space of recognizing that some parents may not have necessarily had their own counselling themselves or therapy intervention as a child when they potentially needed it, we are literally meeting that inner child when we connect with them. So I want to honour that and respect that and acknowledge that and show empathy to that. So that is also very challenging. We know that's challenging in the playroom. It's challenging with parents as well. So I'm spending that first 5 minutes breaking the ice. I'm asking them if they need, tea or coffee or water, just making sure that they feel comfortable, that they're where they're seated, they feel okay. Do they need a cushion? That kind of thing, just so that I want them to be able to regulate themselves enough to be able to start some pretty difficult conversations, right, around how their child is going. So investing in that time is important. Then we go into, and certainly for me, this is how I like to start that conversation of an initial consultation of what's brought you here today. And we know that in counselling practice, that's pretty standard for adult counselling clients. I do that because, again, I am coming from the framework of wanting to invest in the parent and wanting to make sure that they feel seen and heard. We know in the playroom that it's important for kids to feel that sense of safety and trust with us. And so feeling like I'm not directing that meeting with them by asking a bunch of questions and kind of scaffolding, I guess, that conversation in the beginning so they feel like, well, you know, the therapist is in the lead. I want them to feel like they can have their say, because oftentimes for many of our clients, say in the child protection space, in separated family spaces, the parents, and maybe it's mum, maybe it's dad, maybe it's both, they don't feel like they've been heard. They don't feel like they've been heard, and they don't feel like anyone is willing or interested to listen. So I really want to invest in that. That's so important. So I'm spending some time saying to them, what has brought you here? What kind of drew you to coming to play therapy? Start wherever you like. And then I'm letting them tell me all of the things. I feel like sometimes, and again, for more seasoned play therapists, you might have other experiences, so I certainly welcome that feedback as well. But for me, I have found that it's usually, I guess, two kind of presentations. You've either got a parent who is just so anxious, so overwhelmed, doesn't know where to start, struggles to, I guess, kind of articulate, or is a little bit closed off. And that's okay. We want to acknowledge, because again, guys, see how I'm connecting the dots here. If you put that in the paradigm and the framework of CCPT working with kids, we get that in the playroom as well when kids start therapy. There is those kids that are closed off, they don't talk, they're shut down, they're not looking at us, they've got their back to us. All of that happens in the playroom, right? So what do we do? What do we do with those kids? We trust ourselves, trust the child, and trust the process. So it's important. We trust ourselves, we trust the parent or caregiver in this scenario, and we trust that this is a process of building that safety and connection with them. So for adults, obviously, because they're not playing at the time, we do have some questions we can use to start to pull that apart. So we might say things like, what are some of the things that you've noticed at school? What are some of the things you've noticed at home? What are some of those challenges you're experiencing? So we might start to kind of pull some of those questions from them, but you either have two presentations, right? So you're going to have that presentation, or you're going to have the parent who talks for like an hour and 15 minutes, and you have 15 minutes left to do your questions, right? So we are needing to navigate both. And again, if we look at what Gary Landreth says in terms of facilitating that socially acceptable relationship, that is with children of all ages, and that includes parents and caregivers. So I think what is incredible about our approach, but also the work we do with parents, is that we have this opportunity to be able to role model boundaries in those parent consultations as well. So acknowledging to them, this sounds really important, and I really appreciate everything that you've shared. I'm keen for us to tackle a few more different topics, so let's tackle this one now, and so kind of moving through those headings on your initial consultation forms. So taking a step back, I know some practitioners might send questions ahead of time, or you might send a questionnaire ahead of time to have a bit of an understanding before that initial consultation in person. I really believe that initial consultation needs to be in person where we can. We are talking about a real relationship here, and I think that being able to meet face-to-face helps foster that. But there certainly is scenarios where, say for location or difficulties getting to the office, we might do it via Zoom or Teams. So we are starting off the conversation getting them to tell us about the background of the child and the current presenting issues. That's where we're starting in terms of that initial consultation. We then move into a little bit more, of a deep dive into that child's formative years. We know when we're working in the playroom, and this is how I'm caveating it to parents a little bit. I'm deviating slightly, but I'll come back. When we are certainly working in that third stage of play, in the regressive stage, we know that a lot of that content relates to those early years experiences, and more specifically, those experiences of those attachment relationships with primary caregivers. So I always caveat it to parents to say, I'd love to go back a little bit in time, if that's okay, to understand some things around your child in terms of their first couple of years of life. It really helps me in the playroom to understand what the child's communicating. So as much information as you can provide as possible would be great. And so I'm wanting to acknowledge that going back to that time may be potentially traumatic for the parent, if they had a traumatic birth, if they had a really difficult pregnancy. So again, throughout my questioning, I'm making sure that I'm communicating that empathy, our core tenets of CCPT. So making sure we're tying it all together as we progress. So I want to know about the pregnancy. I want to know about the birth. I want to know about that first year of life. Did they meet their milestones? That's just the start of the questions in that space. We go on that journey to have a better understanding of those first couple of years so that we can start to understand, okay, what does that attachment relationship between my client and that primary caregiver look like? What were they exposed to in utero? And as I've said to you guys before, I truly, in the next couple of weeks, now that I've got my studio, I might do an episode on the current research of the impact of 2020 to 2022 on those babies who are now 4 to 6 years of age as of this year and are progressing to school. There is a whole conversation with that. So I have that as a question in my intake when I'm talking about that pregnancy and birth. If it is a child between the ages of 4 to 6, I'm asking them, what was those years like? What was 2020 to 2022 like for you and your family? Did anyone lose a job? Was there financial stress? How did you guys navigate that? Did your child go to daycare still? What did that look like for you guys? Because that's very important. That gives me really helpful information around those first couple of years of life and what that child experienced that becomes part of their unconscious programming of their relationships with others. We know from Dr. Bruce Lipton's research on the conscious and unconscious mind that this is critical, that first 5 years of life, of them downloading without discrimination an understanding of relationships with others through all of their experiences of those relationships and interactions. So doing so without a filter, and it becomes part of their program. So I really want to dive into that and understand and fully, I guess, kind of comprehend what happened. Am I going to get absolutely every part of the story in that first initial consultation? Absolutely not. This is why this is a process. And certainly, we could probably need at least a couple of hours, if not more, really to deep dive into some of the families that we work with and their family of origin history. But we just simply often don't have the time. So that's where those parent consult updates come in handy. And I'm going to talk about that next after these initial consults, because I often use that first parent consult update to say, hey, we didn't get through absolutely everything that I wanted to cover in our initial consultation. Do you mind if I ask you a few more questions, just so I can get a really good sense of an understanding of the child's history? So in a very collaborative, empathetic, accepting way that we are potentially needing to ask further follow-up questions. And certainly from the information we get in that initial consultation, sometimes parents, and they have many different reasons for why they do this, may not give us a true picture. And then we start working with the child, and the child tells us in real time. And that's why I love working with kids more than adults, not going to lie, because they don't have a filter. in the way that adults do. And so, and often, especially for our neurodivergent kids, even more so, it is very transparent what they are telling us. And so we have this opportunity when we do that parent consult update to be able then to say, gosh, I'm just wondering, and then kind of tackle some of more of that information from those formative years experiences. So we're going through a lot of that and getting a really good sense. I want to understand that relationship between mum and dad, or that family system. What did that look like during that formative years? Was there a parental separation? Was there drug and alcohol misuse? Lots and lots of questions around what that family dynamic looked like. What was their support system? What was their network? I'm going to do an eco map and I'm going to do a genogram. And I really want to understand and get a better sense of everyone involved with this child's life. And again, am I going to get all information in that initial consult? Probably not. And that's okay. We will build on that throughout our intervention and our work. So we are going through all of that information before we then move into, tell me about how they went progressing to daycare or school. I want to get a bit of an understanding of, once they got to a certain age, we've kind of tackled those first couple of years, what then did it look like when it was time for them to progress to daycare or kindy or school, whatever you call it in your part of the world. So I want to deep dive into that. Again, for our families that we are working with at the moment with a 4 to 6 year old, that looks like separation anxiety. So if you are working with a 4 to 6 year old now, or you're about to have an initial consultation with a 4 to 6 year old, you can pretty much write that down before you meet them. No, I'm just kidding. You won't do that, obviously. But don't be surprised if they mention separation anxiety. So and this was actually something I was talking to a supervisor the other day about, and really enjoyed the conversation that I had with her about this, because I think that what is happening for that population, and again, guys, I've got to do my own podcast episode on this, but what we're seeing in that 4 to 6 age group is obviously a much higher than expected presentation of anxiety, depression, and separation anxiety. The literature evidences this. So we are then meeting a population of parents who are obviously really struggling, right? Which is why they've come to therapy and why they're meeting with you in this initial intake. But I think there's also a propensity for us to apply child development theory and, I guess, age-appropriate behaviours and expectations without acknowledging that their formative years looked different to what would be normal or typical. So we can't then put an expectation on them at 5 or 6 that they should be able to transition to school successfully when they have had these experiences in their formative years. And so when we're using that benchmark of child development, we need to have a caveat around that to say this population looks different. This population is not going to move and behave and progress in the same way as somebody, a 4 to 6 year old we might have seen 10 years ago. So I'm making sure, as I'm asking these questions, that I'm also providing that psychoeducation along the way where I can. Because for some of these parents, and I know for many of my parents where I have broached the topic of 2020 to 2022, excuse me, that is really hard to say, 2020 to 2022, yeah, I got it, that they've never put the dots together themselves. We lived in a world where we were just trying to survive and function and get back to work. And so that moment of connection where you see parents go, oh, yeah, that was part of my experience too. That is very helpful for parents, obviously, in building that rapport and connection with them, but also helping to validate some of their feelings and some of their struggles. So very much making sure that we are checking in about that, asking how they've gone, if they are in prep. So I'm saying, I'm using terminology, guys, from Australia and specifically Queensland when I say this. So for our kids that have just started school, they would be between 4.5 and 6 here in Queensland. So that is our prep year. So we're asking very much what that looks like and how they have navigated that. Okay, so then I want to move into talking about the health of the child and getting a good sense of their medical history. So I want to get an understanding, is there any diagnoses? Has there been any medical intervention in those formative years? Has there been any diagnoses that relate to my work one-on-one in the playroom? So do they have epilepsy, for example, and what is that plan in terms of supporting the child? So I'm making sure that I clarify and have an understanding of the medical background. Has there been assessments for diagnoses such as autism, such as ADHD, or others? So getting a good sense of that, and if there is other professionals involved that are supporting that child too in terms of that medical intervention is good to know. So then I'm making sure that I've got a good understanding around the family of origin history. We've obviously covered a lot in those first few years of life, of that pregnancy, birth, and those formative years, in understanding the milestones that they have achieved. But I also want to get a sense of, is there anything else of significance that's important to mention here? And I ask again because sometimes it is one of those things where parents might be a little bit reluctant, I guess, to kind of have those conversations, or we may not get that information in this initial consult, and that's okay. Sometimes as we progress in our therapy work and the child tells us more about their story, we get a better sense of what might have been part of those early years experiences. And parents have good reason at times for why they may or may not disclose that information. But I am prompting the parent a little bit here to gauge, has there been changes in schools? Have they moved house? Were they involved in a traumatic incident like a car accident or a natural disaster, or anything that they can think of that they want to mention? So I'm making sure that I've checked that off. I'm then, if the child is in prep, so acknowledging that for some of our younger kiddies, they might be just in daycare, or once they've started school, I want to understand what that experience has been like for them, both emotionally and academically. So I want to understand, are they struggling at school? Are they struggling to do their homework if they're a little bit older? Are they struggling with their peers? Are they struggling with support through the school? Are they being assessed for any type of learning difficulty? So lots of questions there around their experience of the education system, which is really helpful as well. I want to confirm then, and I find this particular question really important in this intake. And again, I just want to acknowledge that everyone has their approach to doing these initial consultations, and I'm sure there is headings that I've not covered that you use. So certainly when we post this on our Instagram, please share, is there other headings or other areas that you tackle in your initial consultation? Because I think also too, having a framework for this around these headings or questions that we want to ask also needs to recognize that we are doing a person-centered, humanistic approach to connection and work with families. So families, children in the playroom, and everything in between don't necessarily follow the agenda. And so we acknowledge that we have this scaffolding, I guess, for this initial conversation. But if you find that some of those conversations go in certain areas or topics that are useful and helpful for the parent to discuss and unpack with us, we will obviously give them that space to do so. But one of the things towards the end of this form that I think is really important is their experience or unpacking and understanding of their experience of therapy. We know, especially for us play therapists in this space, that often the children that we are engaged with have tried other therapies first and not had success. So maybe they have tried talk-based therapies and it hasn't worked, and they're looking for an alternative. So I want to get a sense of, have they accessed support before? What's that previous history like? What worked and what didn't work? So did they feel included in that process of therapy? What do they need in terms of communication and updates from the therapist? Because that gives me a really great launch pad to tell them and explain, I guess, my boundaries around communication with them, updates with them, my support and what that looks like in terms of those weekly, and my preference for weekly play therapy sessions, 4 to 6 week parent consult updates, working with stakeholders, writing reports. I can go through all of my services at that point to tell them a little bit more about what I do. But I also want to acknowledge in our Rogerian practice that they are the experts and they know what works and what doesn't work for them. And so I want to get a clear sense of that so that I can make sure that their experience with me is a positive one. So I'm checking in about that and then giving a nice segue into a little explainer around child-centered play therapy and what it's all about. I then go into the goals of therapy, which is very important. And again, I will do a separate podcast on that because this episode is going to be so long already because I've got still more to cover. But we, in terms of that process, do the goals and then offer the opportunity for parents to ask questions as well. This is in a perfect world where we go through and complete everything in that time period, which doesn't usually happen. You can imagine just from the questions we've covered so far, it's a lot. It's a lot. So, and also too, I'm really mindful, as I said at the start of this conversation, it's so important that we are investing that time in establishing that safety and trust with the parent or caregiver to build that relationship. So we may only get through so much and maybe need to schedule a further intake session if that's the case. Or as I said, sometimes we use that first parent consult update as another opportunity. So after we have offered the opportunity for parents to ask us questions and get a real sense of what play therapy is all about, we make sure that we then explore with them whether they would like to continue with us. So it might be a situation where they want to go away and have a think about it, and that's okay. This is as much a process of connecting with the family, with the parent or caregiver, and ascertaining if play therapy will be suitable for them as much as, am I the right therapist for you? Am I the right therapist for your child? And so that is a process of exploration for both parties, and important to recognize and honor that consent is voluntary for our parents, certainly in private practice. And so they have that right to decide. So we are, if we're not booking in a play therapy session straight after, in terms of making an appointment at the end of that intake, we are offering the opportunity for parents to get back in touch with us if they would like to book in that play therapy session. So giving them that autonomy of choice. So that is an initial consultation, parent-carer consultation. As I said, there is lots of training out there in our beautiful community around how to do an initial consultation. So if you have a slightly different format, that's great as well. That's great. I think that we use the framework and the structure and the scaffolding that works for us as the individual play therapists. So this is simply suggestions to add to your practice. So we are going to pause there because we have so much content we want to cover for introducing the topic and unpacking initial parent consultations and ongoing parent consultations that we just couldn't fit it all into one episode. So we've got a two-parter for you guys. So thank you so much for watching today. We have much more to cover next week. So we will have a part 2 of conducting parent consultations, including initial and ongoing parent consultations. So you will just have to stick around next week to hear the second half of our conversation on this. It is not the end either. I know we'll do many more episodes in this space, but thank you so much for listening. And please, as always, check us out on the socials. We're on Facebook, Instagram, and TikTok at the Play Therapy Circle podcast. And you can also reach us now by email if you want to suggest some ideas for future podcast topics. We're always keen to hear from you. So hello@playtherapycircle.com. We would love to hear from you. So thank you so much for being here. Please be kind to yourselves and each other. And we will get back into this next week for part 2. See you then. Bye. Thank you so much for being here for another episode of the Play Therapy Circle. If anything resonated with you today, I'd love it if you could follow the podcast, share it with a colleague, or leave a short review. It really helps others find our circle. And if you have a topic or question you'd love me to explore, I'd love to hear from you. This space is for you, and I want it to feel like a conversation. Until next time, take care of yourself, and remember, you belong here.